radical left has taken over the Democratic Party.
Hello and welcome to Think Progressively, covering politics and all the other chaos life has to offer. This is episode 14, recorded on Wednesday, November 18th from Milwaukee. I'm Joe.
And I'm Jason.
And on today's episode, we're going to dive into the current worldwide COVID spike and what that means heading into the holiday season here in the United States. But first, the headlines.
Fake news.
Fake news.
Fake, disgusting news.
Up first in headlines, we have some election updates for you all. Where do you want to start, Jason?
Start here at home.
All right. As of today, the Trump campaign officially requested a partial recount in Wisconsin. The two main counties that he wants recounted are Dane and Milwaukee counties. For those who don't know, Dane is where Madison, a heavily populated and Democratic stronghold, is, as well as our state's capital. To the tune of $3 million. For what? Why are we doing this, Jason? I don't want to.
So that they can uncover maybe a couple dozen votes that were counted incorrectly and then claim that proves widespread voter fraud and that they won the election.
Well, and why wouldn't they do the other Republican counties? Why wouldn't they do the predominantly white counties?
Because they won those?
Oh, okay. I was thinking racism.
Well, it's racism is the reason they won them in the first place.
Okay.
And I say that living in Waukesha County. My neighbors used to have a Confederate flag up in their window.
That sounds charming.
Yeah, oh, real charming.
So we aren't expecting anything really to change with this. It is very unclear as to why they did just a partial election. They didn't give any reasoning, like an exact reasoning for it. The only thing we can even speculate as of right now is just because there was a mass turnout in both Dane and Milwaukee counties, and they just don't like that.
Well, they know that's where Biden won. So if there's going to be votes to overturn that will be in their favor, it's going to be out of those two counties. And also, there's the expense involved.
Right. Well, if they were going to do the entire state, we were looking at an expense of around $8 million. So I'm kind of curious. Do you think it's because they actually didn't have the money for it? Or do you think they chose not to do an entire recount?
I think a little both. Why spend the money and recount votes that you already have? It's very unlikely that election officials, who you would think coming out of predominantly Republican counties in the first place, are probably not going to be big Joe Biden supporters and looking to cheat for the Biden campaign. There's also another recount ongoing in Georgia that's just finishing up.
Did they just finish up, or are they still finishing up?
Last I heard, this was just a few hours ago, there's an NPR article saying that they're concluding the hand recount.
Okay.
And that, big surprise, Joe Biden still won.
Whoa. But what about all the fraud? I heard there was so much fraud that was happening. That's why there was the lawsuits, right? It's all the fraud.
Yep. All those dead people that voted.
Yeah. Did that happen?
No.
Did their super liberal Secretary of State rig the election?
Apparently he did it well enough where they still can't figure it out.
Oh, okay. I think he's a Republican too.
Rhino, I hear.
Did you see the president actually called the Georgia Secretary of State a rhino?
Yep.
Oh my God.
There were some. Trump did get a couple thousand votes, which is kind of unusual. Usually recounts only flip maybe a couple dozen votes at the most, but apparently people in Georgia need to learn the whole memory card
not necessarily
thing.
recounts, but it was the whole audit, right? So it wasn't that they flipped votes. It was more so that they actually found votes that weren't counted at all.
Yeah, that were apparently counted, but not uploaded into their system.
Correct. So there were, I think, up to, 6,000 total they found in the entire state of uncounted votes for a various couple of reasons. Some were left on memory cards that just never made it in. Those were partially going for, I think most of those were pretty even, right, on the memory cards?
It depended on the county. I saw one that was heavily Trump and then one that was slightly
For Biden, yeah. And then on Monday, election officials in Floyd County, Georgia, found approximately 2,600 early votes that were not scanned or tabulated. This resulted in a net gain for about 700 to 800 votes for Trump. And it looks like this was actually a pretty big blunder.
Yeah, they've asked the chief clerk of elections to step down in that county. He probably deserves it. He'd screw up that bad.
But let's remember here, so the process of what's happening is still working. These votes would have been found one way or another. So the process is still working the way we want it to. There is no weird voter fraud. There is no weird conspiracy that's happening. Our vote system isn't rigged against anyone. These are issues that happen, even though this is pretty bad, though, with this one instance. But like, these are issues and miscalculations that happen every election.
Yeah, these are just well-meaning people making mistakes.
Correct. So don't worry about Georgia. It's going to be over soon. Hopefully the entire count will be over soon, even with Wisconsin recounts.
Well, as we said last week, they have a deadline where everything has to be settled by early December.
So just wait. Deal with your crazy family during Thanksgiving, and then you'll be over soon.
And even if both Georgia and Wisconsin were somehow given to Trump,
that still doesn't
yeah,
do anything.
Which they won't be.
Nope.
No state has ever been overturned due to recount.
Nope. And while Trump has been focusing on winning an election that's unwinnable, he's also been busy firing people, doing what he's good at, I guess.
Got to use that catchphrase.
As of Monday, I know this is a bit older of a story, but Trump did fire his defense secretary, Mark Esper, in his usual fashion of tweet, of course.
Yeah, this has been expected ever since the summer when Trump was talking about using the U.S. military to quiet down the
protests
after the George Floyd incident, Black Lives Matter, and Mark Esper publicly
disagreed with him.
Yeah, said that that's not what the military should be used for. Ever since then, everyone basically assumed that he was going to get fired because Trump is a baby and you can't disagree with him publicly. He's going to fire you.
There was also a lot of tension between Esper and Trump over withdrawing troops out of Iraq, where Trump wanted to immediately withdraw large amounts of troops, which would have completely dismantled the entire region, and Esper publicly disagreed with that as well and refused to do so. So this is nothing unprecedented.
It's a bit odd coming right before the end of...
It's like a total spite firing. Like, if I'm getting fired, you're going to get fired before I do. And speaking about spite firing, Trump also fired Election Secretary Director Chris Krebs over correcting voter fraud misinformation that Trump has been spewing for the last several weeks now. And I just want to read his tweets for how he fired Chris here. So Krebs made a joint statement with other officials that you may have seen before, saying that how the 2020 election was actually one of the most secure elections in U.S. history. In the statement, it actually does say in bold, there is no evidence that any voting system deleted or lost votes, changed votes, or was in any way compromised. Basically going straight up against what Trump is saying. Trump responded in tweets saying, the recent statement by Chris Krebs on the security of the 2020 election was highly inaccurate in that there were massive improprieties and fraud, including dead people voting, poll watchers not allowed into polling locations, quote-unquote glitches in the voting machines which changed votes from Trump to Biden, late voting, and many more. Therefore, effective immediately, Chris Krebs has been terminated as director of the Cybersecurity and Infrastructure Security Agency. And of course, under both tweets are immediately, this claim about the election fraud is disputed by Twitter.
It should just say lies
right
underneath. Be more accurate, concise.
So Trump is literally firing people just for telling him that he didn't win the election and not parroting his lies constantly. But this is what you see from a cult leader. This is what you see from completely psychopathic and pathological liars who cannot afford to lose in any way means necessary, because this is what will affect their ego the most. They can't lose.
And without COVID, he probably wouldn't have. And it hurts me deeply. I don't understand it. He's so very clearly just a narcissist and a fraud. And he has millions of fans across the country. And I don't understand.
And in further election chaos news, the Wayne County Elections Commission in Michigan initially deadlocked on actually certifying the election results. The Elections Commission split 2 Democrats and 2 Republicans. The 2 GOP members said that they refused to certify the results due to election irregularities and concerns. This then led to a widespread outcry by Democrats everywhere, saying that they're spreading more misinformation and had nothing to go off of, which actually made the 2 GOP elections members backtrack and then certify unanimously.
This is the county that includes Detroit.
Correct.
Clearly, Trump was not going to win Detroit. again, just like we saw in Georgia, you may find a couple dozen, a couple hundred votes that were missed, miscounted. You can look for irregularities. Maybe you find a signature that doesn't match, whatever. You are not going to overturn the vast quantity of votes that you would need to make a difference here. There is no conspiracy. It's just that people make mistakes. And the fact that these two officials were willing to hold up the entire democratic process here in order to make some kind of point about election fairness. This election is no worse than any other election we've ever had. There's no more fraud. There's no more irregularity than any other election we've had in the past. It's just highly politicized and being blown completely out of proportion by our president, who cannot accept the fact that he lost. And it was only after voter outcry, because basically their votes are being stolen from them, their voice was being squashed by two Republican election officials, that they changed their mind.
And I do like this little segment in the New York Times article here that talks about, from Mark Brewer, an election law expert and former chairman of the Michigan Democratic Party, noted that Ms. Palmer's, who is the GOP member of the Elections Commission, motion would have actually blocked certification for Detroit, like Jason said, where black residents make up 78% of the population, and certified that results for communities like Livonia, where the black population is 4.4%. And quote from Mark Brewer, Monica Palmer sat there and said that she's willing to approve the results of the lily white city of Livonia, which had the second highest number of out-of-balance precincts, but won't certify the city of Detroit. There is no reason to single out the city of Detroit for this racist treatment. And I think there's a real argument to be made here that racism has a big part in this, because so many Republicans were so blown away by turnout by people of color. And I know we talked about this last time, where even in Milwaukee, they said, well, black turnout was so high in Milwaukee, there had to be voter fraud.
It's all of the predominantly black communities. And we said it last time, right? Atlanta, Detroit, Milwaukee, Philadelphia. Why are they singling out those cities in particular?
But why are they singling out those cities when they're intentionally leaving out predominantly white cities that have the same exact issues?
Vote counting errors don't matter if Trump won those counties. They only matter where he lost.
But what scares me with this is, yes, we already know how Trump is a petulant little child. Fine. And we already talked about how he's going to cry all the way up until January. Fine. I'm concerned that you have people in power, like in the Michigan Elections Commission of Wayne County, who are still buying into this nonsense. That's what scares me. We have people in Wisconsin that are talking about how the election should be null and void because of all the issues here, when there aren't any. I'm sure it's happening all over the United States as well, where you have people in positions in power who are just spreading lies and misinformation.
And this started before the election even happened.
And it doesn't matter if it's because of ignorance or if it's intentional. The outcome's the same. We are sowing doubt in our own processes here, which we need to have trust in to actually have a functioning country.
Yeah, will people ever have faith in our elections again after this? And there's no reason.
There's close to half, I have no idea. I did see a poll that did say, I think, close to 70 or so % of people think the election results were fine, or you can trust the election results. So at least 30% of the people, a third of our country, thinks that our election results should not be trusted. And shocker, I wonder how many of those are actually Trump's base.
That's going to be his legacy. I am so sick of talking about Donald Trump. Out with the old, in with the new. Let's talk about what Joe Biden's been doing, president-elect.
Well, good, because while Trump's been firing, Biden's been hiring. See what I did there?
Yeah, I kind of noticed in text that that's what you were going for.
You know, you're not supposed to say, like, what it's in our script or something. You dick.
When I read it a couple hours ago.
You're supposed to act surprised like I just told you.
Those words rhymed.
You're a regular Shakespeare. A regular Dr. Seuss, I say. In Biden's first key appointee, he names Ron Klain to be the White House chief of staff. The campaign announced on Wednesday evening.
Was also his chief of staff when he was vice president.
He was. He's an alumnus of the Obama-Biden administration. Klain had previously been Biden's chief of staff when he was the vice president. And quote from Joe Biden saying, Ron has been invaluable to me over the many years that we have worked together, including as we rescued the American economy from one of the worst downturns in our history in 2009 and later overcame a daunting public health emergency in 2014.
I don't know. He's a guy. Whatever.
Well, and let's be real here. This isn't anything surprising here. He's an establishment Dem. He's a White House veteran. He knows what he's doing. Of course, this is kind of the guy that Joe Biden picks.
Someone with experience and competence.
Pretty much.
If not terribly exciting.
As for some other people that Joe Biden recently appointed, he recently named Jen O'Malley Dillon as Deputy Chief of Staff and Steve Ricchetti as Counselor to the President, among others, which we won't really go into because there's a lot of people. And just a few key things about each one of those. O'Malley Dillon is the second woman to lead a successful presidential campaign after Kellyanne Conway for Trump. Hooray. She also managed former Representative Beto O'Rourke's rival campaign for president before joining Biden's campaign. She previously served as deputy campaign manager for the then President Barack Obama's 2012 re-election campaign. She served as the executive director of the Democratic National Committee and Battleground States director for Obama's 2008 race. So again,
establishment Dem.
Yeah. For Steve Ricchetti, Ricchetti served as a chief of staff to Biden during his second term as vice president, a deputy chief of staff for operations for then President Bill Clinton, and also was between jobs. Ricchetti's lobbying firm represented groups including the American Hospital Association, Health Insurance Association for America, drug makers such as Eli Lilly, Novartis, Pfizer, and, oh God, is it Sanofi Aventis?
Whatever.
Okay.
Big Pharma.
Right. General Motors and communications firms with AT&T and Nextel. So again,
ooh,
it's not surprising, you guys. It's Joe Biden.
Yeah, his pharmaceutical connections are particularly disgusting.
But this is the stuff that we need to call him out on, right? Where, I mean, yes, the Republicans are going to still call him a radical socialist, even though they have no freaking idea who these people are going to be because they don't actually watch the news. But these are people who are going to basically push the status quo, not really do much for us in the long run, and it's going to be up to us to make sure they go as left as possible.
Yeah, he's going to socialize medicine. That's why he's bringing in
the pharmaceutical guy.
Yeah, and the guy's...
Or the pharmaceutical lobbyist.
And Health Insurance Association, American Hospital Association. Like, that's not what you would do if you're looking to socialize healthcare, unfortunately. So, yeah, we'll keep an eye on who else he nominates, who's terrible.
We are expecting to see who will be filling out Biden's cabinet rather soon, so stay tuned for that as well. And while we're at pushing Biden to the left, let's talk about this new article today. A new article from The Hill recently said that Elizabeth Warren is currently pushing President-elect Joe Biden to cancel student debt in one of the single biggest stimulus bills in history.
I saw quite a few jealous people. I don't know what you would call it. People that don't want to see anyone else get anything that they didn't have.
Oh, okay. I know what you're talking about now.
On Twitter, complaining about this, saying, well, I had to work my way through college and pay off and do all this. Why can't everyone else too? Yeah, that's great.
How dare they have better lives than we
Right.
do?
Like that's progress. That's saying, like, yes, it was very tough for you to pay off all your student debt, wasn't it? Didn't that really suck? Wouldn't your life have been so much better if you didn't have to do that?
Well, especially now where you have so many people who are finding issues with jobs, who are out of work, and have crippling student debt they still have to deal with.
Some people got scholarships or their parents paid for their educations. So what's your point? I mean, I don't get it. And it's people like Michael Shermer, the editor of Skeptic Magazine, who, Jesus, I used to respect. And just seeing these terrible arguments, like, you're supposed to be a critical thinker. And you're coming up with, well, I had it bad, so they should too.
But that's the whole point about being a humanist and a progressive, though, right? Where you have this idea that what we have right now could be better in some way, or it should be better in some way, and let's try to find a way to make it better. Why can't we do that? What's so wrong with that for a lot of people?
What it really boils down to is Michael Shermer doesn't want his taxes to go up.
So selfishness, basically.
Yes, selfishness and some misguided sense of fairness.
Which is nonsense anyway.
He literally wrote a book titled Why People Believe Stupid Things.
And here he is.
Yeah. Maybe he hasn't read it recently.
So let's get back to the article. Senate Minority Leader Chuck Schumer said this week that he and Warren have a proposal to cancel $50,000 of debt through executive action. Quote, "We believe that Joe Biden can do that with a pen as opposed to legislation," which is awesome. I love the idea. Thank you, Warren, and thank you, Schumer.
I really don't like executive orders, but
I mean, if we have a combative Senate, though, I don't care.
I get it. I get the reason why. And again, if it's used for the betterment of society, it's hard to argue that they shouldn't do it, but it's not the way our government's supposed to work. I just want Republicans to not be obstructionists, but that's probably not going to happen.
However, Biden has yet to endorse any type of approach like that. He did say on Monday that he wants to cancel $10,000 of debt, but that's about it. Well short of what Schumer and Warren want. So again, we need to push Biden to the left.
But not physically. He'll fall over.
He has very weak knees.
Left wing, we're going left wing all the way.
So let's talk COVID. It's not good right now.
We come to you from literally the bowels of COVID, aka Wisconsin.
So let's go through some of the numbers for the United States as of right now. Currently, there are approximately 11.4 million total cases in the United States. As far as new daily cases, we're looking at 159,508 as of yesterday, looking about 2,000 less the day before and about 5,000 less the day before that. So you're looking at a decent increase each and every single day as far as new cases goes. States with the fastest growing number of COVID cases per capita include North and South Dakota, Iowa, Wyoming, Minnesota, Nebraska, Wisconsin, Montana, Illinois, and Kansas, all in the Midwest and upper Midwest areas.
Where it's getting colder.
Correct.
For deaths, we have 248,000 total deaths. That's 250,000 for all of you math people out there. Daily deaths.
Super deep cut.
Yeah, you only get that kind of analysis here. Daily deaths yesterday, we had over 1,500, 1,200 on the 16th and on the 15th as well. So deaths are rising, which is what we would expect. Usually you've got about a month lag between spikes in cases followed by spikes in deaths, unfortunately. And there will come a time, and we saw this early on with Italy, once our medical infrastructure gets overwhelmed and they don't have places for people anymore, those deaths are going to sharply increase because they're just not going to be able to treat people. And it's going to start affecting non-COVID cases as well. So that's the real fear. This will overwhelm our medical system. Not to mention, again, here in the United States, as opposed to anywhere else in the industrialized world, if you go to the hospital and end up in the ICU for COVID and you're not, the president, you might recover after a lengthy stay.
But you're paying for it.
But yeah, you're going to be broke. You're going to have to declare bankruptcy. Hopefully you don't lose your house or your car. It's going to change your life, if not medically, financially. And that's horrible. It's a horrible outcome for all of those people. It shouldn't be that way. We need to work on building a society that would make it so that it's not going to ruin your life if you have to go to the hospital. And that's why we don't want to see insurance and pharmaceutical lobbyists as part of Joe Biden's campaign. But back on topic here, the states with the fastest growing number of COVID deaths per capita are pretty much similar. North and South Dakota, Montana, Wisconsin. Yay, we make both lists.
We jumped in deaths, too.
Oh, yeah. Well, we are, I think, the highest capacity right now state for COVID patients.
I didn't look that up, but I think you're correct.
Yeah, that's what I heard. It's been bad here, like really bad here in Wisconsin for the past couple weeks where cases have just been skyrocketing. You look at the graphs.
Still over, I think, 7,000 a day, right?
Yeah, we're still over 7. We set a new record. It was all lucky sevens. 7,777 is our current record. I'm sure we'll break that shortly. It's like a roller coaster you can't ever get off of. We also have newcomer Guam on the list. Illinois, Iowa, Wyoming, and Idaho. So again, mostly upper Midwest, but also New Mexico and Guam. But I think that Guam, it's, per capita, that's going to be a big.
Correct. And I think that's why they made the list too. And then globally, we're looking at about approximately 56 million cases of COVID-19.
Which again, we're 11 million of those.
Mm-hmm.
So a fifth of the COVID cases. We're not near a fifth of the total global population.
And as far as total deaths go, approximately 1.3 million deaths worldwide. As far as countries with the fastest growing COVID cases per capita, we're looking at Montenegro, Luxembourg, Andorra, Georgia, the country, obviously not the state, Austria, San Marino, Slovenia, Switzerland, Croatia, Poland, and then United States ranks 21st on that list.
Hard to grow per capita when you're already at the top.
Right. And then as far as COVID deaths per capita go, the top countries are Slovenia, Bosnia and Herzegovina, Czech Republic, Liechtenstein, Belgium, North Macedonia, Montenegro, Bulgaria, Switzerland, and Hungary. The United States ranks 38th worldwide for COVID deaths. And also, by the way,
this is fastest growing.
Yes. And by the way, the United States still leads the world in total COVID deaths and cases.
We're number one. We're number one.
And second only to Brazil in that category.
See, when they say the United States is the greatest country in the world,
we're winning. All the winning. We're great.
We mean for COVID, like the actual virus. We are the greatest country in the world if you are the COVID virus. Come here, bring your entire family. Notice there's no Asian countries in either one of those lists.
And I wonder why.
Apparently wearing masks actually works. And I've seen, I watch a lot of YouTube. I'll be honest. One channel I watch is a travel food channel, and the guy is in South Korea currently. He just went there long term because he was worried about COVID here, and he got to see the quarantine process. They take it extremely seriously.
They do.
And he goes out, does the food vlog and all that kind of stuff. It's so different there. Everyone is wearing a mask out in public, but there's still, you can still go out to restaurants. There's still people eating inside a restaurant. I'm terrified to eat inside a restaurant right now. I will not do it. But there, because they take everything so seriously, it's fine. They have single-digit cases.
Well, did you see the bar that was going around? And this is all local news, but did you see the bar that was going around? It was a picture of a fully packed bar that they posted on their own Facebook page.
I'm not surprised.
Oh my God. It was this one random bar that had a live band playing. And they're like, come check out so-and-so playing here tonight. And the entire place was just packed with people, shoulder to shoulder. No one's wearing masks at all.
Every bar I drive past, the parking lot's full, and these are tiny places. That's the thing. We could get to that point if our cases were low enough and we took this seriously. You can get back to quote-unquote normal, where you're able to go out and do these things. But you got to get the spread down first. And here, it's it's skyrocketing up, and there's thousands and thousands of new cases every day. They had to change the reporting metric for our counties because they were all at the top, whatever the highest rate was. So they actually had to add another category so we could kind of differentiate here to see which counties were doing worse than others because they were all at the highest amount.
And I agree with you, too, where we could be doing these things. We could have been doing these things, but now we're living in a country where a lot of states are already considering going back to safer at home and quarantine orders because states are out of control.
And they should. We should here, except they'll just get sued by the Republicans again to stop it.
And we'll get into all that a little bit later, too. And one thing I really want to stress as well, and even though this may sound like a Republican talking point, is COVID is an economic disaster around the world. The Brookings Institute recently released a study saying that a lot of countries worldwide are experiencing higher rates of extreme poverty, especially in places like Asia and Africa. India is actually the worst country right now, where they are actually tripling the number of people in extreme poverty, with almost 150 million people experiencing extreme poverty. A lot of those people are actually people who just got out of extreme poverty, and now their economy just collapsed beneath from them again and are now falling back into extreme poverty once more. And Nigeria is in second with nearly 90 million in extreme poverty. This is bad. This is really bad.
Yeah, you see it all over the news, right? People getting evicted because they can't go to work because it's not safe.
Well, and this is where a lot of places worldwide, just do not have the resources to combat this thing. They just don't. And what they're doing is they're doing what they have to do every single day and just hoping they don't get it.
Sounds a lot like what we're doing here.
Correct. So either they're going to hopefully just not get it and expose themselves, or they're actually going to stay home and shut down, and the entire economy just goes to crap because of it. Where a lot of these economies did not have the funds to manage them through this type of thing. Where at least in America, we can do that. We can actually put out a multi-trillion-dollar stimulus plan, even though our freaking Senate won't do it. And we'll talk about that in a little bit too. But we have the capability of doing that. Places like Nigeria, the Philippines, and whatnot do not have the capital to do something and cover their citizens the way that we can here.
At least they can go to the hospital for free.
Well, in some countries.
Yeah, it's going to be a serious economic crisis for a long time coming. And that's my biggest issue with the Republican plan when it comes to COVID. Their idea is just, well, we need to get out there. We need to go to work. Everybody needs to start spending money. We got to get our economy back up and running. You can say that, but there are plenty of people like us that do not feel safe out in public right now. I do not feel safe going to a restaurant or a bar, drinking or eating with my mask off.
I was going to say the exact same thing.
In a room full of people who are doing the same thing. What are the odds here in Wisconsin? Like 1 in 3 or 4 people has COVID? How in the world would you feel safe doing that? So it doesn't matter that you say, well, we can't have any government restrictions on businesses. We need to be able to keep the economy going. The economy is never going to get back up to where it was until everyone can feel safe in public. And that's the problem. That's what they don't care about. That's the step they want to skip. Just don't worry about it. Just go out. Who cares if you get sick? Who cares if you kill your parents, kill your grandparents? Who cares if you die? Just go out and spend money and prop up the economy for them.
For the next quarter.
No, for them. That's what they want. They want you to go out and die so that their stock prices don't go down.
Well, that reminds me all the way back to, who is it? Greg Abbott, the Attorney General of Texas?
That's Dan Patrick.
Dan Patrick, thank you.
The deputy governor.
Who literally said the elderly should risk their lives for the economy and saying that they should be ready to die for their country. It's insane. It's absolutely insane. And we had to drag them kicking and screaming every single freaking day. And they are finally acknowledging that COVID's real and that we need to live with this thing and that we need to actually have restrictions in place. But they still won't do anything. They'll admit that we have to do something about this, but they won't actually lift a finger to do it.
Particularly here in Wisconsin, our state legislator.
I mean, that's exactly what I was thinking of.
Lift a finger to do anything.
Well, you have our state assembly majority leader who's literally begging people to wear masks while also trying to take away our mask mandate here. It's infuriating.
We need to have a cultural change. We need to embrace the science. We need to embrace wearing masks, staying safe, limiting the spread, limiting the exposure. If you think that you have COVID, go get tested. If you're positive, stay away from people. You just have to use common sense, in my opinion, but people aren't willing to do that. They don't want anything that restricts their ability to live their lives, even though they're going to kill other people. And I don't understand it. And our leadership and government is not helping anything. They are not leading by example. They are not embracing experts. They're spreading misinformation and conspiracies.
Well, and those are all for short-term results. Going back to the global crisis or the global economic crisis, we need to have long-term solutions to these things. We need to find ways to live with the virus because it's going to be a long time before we can have enough people vaccinated where we don't have to worry about it anymore. With that said, we have to have a good compromise between letting people go and doing what they want while also being safe at the same time. And heck, that's even what the World Health Organization has been saying as well. And the CDC has been saying the same thing, where we don't necessarily want an entire lockdown for everything or everybody because those are short-term solutions. We want to find ways where you can consistently live with this virus in a good and economic way, or at least in a good economically valuable way for everyone. But until we find out that nice compromise, we're never going to get there. And we're never going to get there until our numbers start at least plateauing And that's never going to happen until people put their freaking mask on.
So we do have another update on vaccine progress, which I think is where a lot of people are kind of banking on, is the miracle vaccine coming quickly, which it will help. And then we can actually start using the term herd immunity, and we'll need to rehabilitate that term, I feel, because right now, and I just heard this on, I think it was the Stephen Colbert, The Late Show, where they're dismissing the term herd immunity because it's being used irresponsibly and being talked about as everyone just getting the virus.
The natural herd
until
immunity.
we achieve herd immunity.
Well, and we'll talk about that with freaking Scott Atlas, too.
So we're going to have to, when the vaccine is available and half the country doesn't want to take it because they think it's the mark of the beast, we are going to have to push for everyone to get vaccinated, whether you think you're at risk or not, whether you had COVID or not. We're going to have to push everyone to get vaccinated using the term herd immunity, because that is
The correct term.
right. That's generally when it's used, and that's when it's used responsibly. It's always been used when you're talking about vaccine levels, because as we're seeing with, Pfizer's saying that now their vaccine is 95% effective, and Moderna saying theirs is 94% effective, which is high for a vaccine, by the way. Vaccines are not and are never 100% effective, meaning even if you get it, it's not going to produce the right immune response in you. You're not going to benefit from the vaccine. There's also going to be people that aren't able to get the vaccine for one reason or another. There's going to be infants that are too young to get it. There are going to be situations where we're still going to have unprotected people in the general population. But if enough people that can get the vaccine get it, and it's 90+% effective, that means that we will come to a situation where the virus is not present in the general population because it doesn't have enough hosts. So there's no communal spread. And that will effectively give us herd immunity. And that's where we need to use that term. That's what we need to get to eventually down the line. And I think we need to start now trying to rehabilitate that term, because you're going to have the same people. Like I heard Stephen Colbert talking about how terrible it was to talk about herd immunity. He's going to have to, probably 6-7 months from now, start using that term as a positive. And I don't want people to get the wrong impression and think that he's being a hypocrite or that, somehow his views have changed. No, it's when you're talking about herd immunity by everyone catching a disease is not the same thing when you're talking about vaccinations.
Well, shocker, it's all about using the terms correctly. That's all it is. But what I really want to focus on from Pfizer's press release about their phase 3 study concluding. So yeah, Jason, like you said, that their vaccine is 95% effective against COVID-19 beginning 28 days after the first dose. And that really stuck out to me too, where I can see a lot of people just getting this first dose, not realizing that it's not effective immediately, and then just going out and doing whatever spit and swap parties you want to have, like the very night. Say, I'm an immune, let's have an immune party or something stupid like that.
Talking about orgies?
I mean, it could be. It doesn't have to be. But I do want to talk a little bit more about this vaccine and just about the results of this. 170 confirmed cases of COVID-19 were evaluated with this vaccine by Pfizer, with 162 observed in the placebo group versus 8 in the vaccine group. Efficacy was consistent across age, gender, race, and ethnicity demographics. Observed efficacy in adults over 65 years of age was over 94%, which is really good because that's our most vulnerable demographic. The safety data milestone required by the U.S. Food and Drug Administration for the emergency use authorization has been achieved, which is also amazing. That means it's going to fast forward the process for us. And then data to demonstrate the vaccine was well tolerated across all populations with over 43,000 participants enrolled. No serious safety concerns observed. The only grade 3 adverse event greater than 2% in frequency was fatigue at 3.8% and headache at 2%.
And those are very
Common.
Well, and they're generalized symptoms. You know,
Yes.
I've been feeling fatigued.
And then finally, the company does expect to produce globally up to 50 million vaccine doses in 2020 and up to 1.3 billion doses by the end of 2021. So this is good news.
And it's a 2 vaccine.
Yep.
You have to get multiple doses, and it will be definitely a useful tool. But until we reach, what was that word again? Herd immunity, we do
Satan.
we do need to continue the masks, the social distancing, all those things that, you know, we talked about people not doing enough. We're going to have to keep it up, at least it looks like until the summer, maybe all of next year. We'll have to see what vaccination rates are. Because again, your crazy relatives are probably not going to get the vaccine because they're going to think it's the devil.
I'm already gearing up for people telling me that usual anti-vaxxer trope. Well, if your vaccine works, why are you afraid of me not getting one? I'm already gearing up for that.
And that's when we bust out that herd
Shovel.
immunity. Well, okay. The lie and the rope and do that too. We'll talk about that after the podcast.
And Jason, why don't you talk about the Moderna vaccine for us?
So I thought it was kind of fun, you know, after Pfizer released theirs and they're like, 94% effective. And then Moderna came out and was like, we're 95% effective. I'm waiting for the next one to come out and say they're 96% and see if we can eventually get it up to like 108%.
It actually postpones COVID like in your offspring or something like that.
The next 2 times you'll get it, you won't get it. According to the BBC, the trial that was involved for the Moderna vaccine included 30,000 people in the U.S., with half being given 2 doses of the vaccine 4 weeks apart. So another 2-dose vaccine. The rest were in the placebo group. Analysis was based on the first 95 to develop symptoms. Only 5 of the cases were in people given the vaccine. 90 were in those given the dummy treatment. Placebo. I don't know why they say dummy treatment.
Because they're British.
Dummy treatment.
Can I have a dummy, please?
The company says the vaccine is protecting 94.5% of people. The data also shows that there were 11 cases of severe COVID in the trial, but none happened in people who were given the treatment. So that's another important thing, right? Is even if you do get it, even if you were one of the people that it wasn't effective for preventing, it might limit the severity, which is something else to consider in all of this. So if America is not very good at controlling the spread of COVID, at least we are a useful testbed for vaccines. Because you figure if you have a large trial, probably tons of people are going to get exposed to COVID
Right,
at some point.
You have a good sample to work with.
Yeah, we're at least being effective with that. It wouldn't be ethical for them to purposefully expose people to COVID to see if their vaccine works. Instead, you just take them to America.
Where the real dummies are.
That's 2 different vaccines now, and hopefully more in the future. So that's positive. It's something we should be looking forward to, but it's not going to help us today and tomorrow. The only thing that is going to do that is by being responsible and limiting our exposure to other people. And we are coming up on Thanksgiving in 10 days here. It's going to be Christmas soon. Everybody generally gathers with their extended family. Are you going to have a Thanksgiving there?
It's going to be very small. Just 3 of us. So no big family gatherings, nothing crazy like that. Probably the same thing for Christmas, too.
Yeah, I got you. B is just going to be me and my wife. Just 2. And that's given the fact that we live next door to my in-laws. They're still not invited. My mother-in-law listens to this podcast. Should cut that part out.
Did I tell you that several of my family members are flying to Florida for Thanksgiving? And when I mean several, I mean like 12 or so, 12 to 14.
You did tell me, but for the podcast, I'll pretend that you didn't.
Thanks. I
What?
hate you so much. So yeah, several of my family members are choosing to fly down to Florida because they can't take COVID up here anymore. So they're going to get on a plane, which is the worst thing you can do right now, fly to Florida, which is not a good place to go to. And to top it all off, one of my family members has COVID and they're going to fly anyway.
Hear that? Anybody going on a plane to Florida anytime soon, it's going to be COVID roulette.
So when we're talking about common sense here, this is what I'm talking about. Just don't actively do things that are stupid.
Like flying on a plane while you're positive for COVID. Even the president didn't do that. He just sat in a car with other people.
All right, what do you think is going to happen with the holiday season in America? How bad do you think the rates are going to spike?
They will continue to go up. It will, at least in parts of the country, unfortunately, I think here in Wisconsin, it will begin to overwhelm the medical system. You are going to have increased triaging of patients and people basically just sent home that should be in the hospital, but there's not going to be a room. And a couple weeks later, you're going to have an increase in deaths, which would be entirely preventable if people would just be reasonable. Yes, I know it's horrible. Again, I've mentioned this before. I have an 82-year-old father that I barely see right now because I don't feel it's safe for me to go. He's in a home. He's got advanced Alzheimer's. I don't think it's safe, even though I've been relatively safe. I have had to go to work over the past couple months. We are back to going remote now, but I have been exposed to other people. I don't feel it's safe to walk into a home full of elderly people that I could kill half the place if I happened to be an asymptomatic carrier. So I haven't seen him very much at all in months. This could be potentially the last Thanksgiving or Christmas that I would get to spend with him, and I won't. And that is horrible, and I feel terrible about it.
But it's because you're actively not trying to kill him.
Right. It's just trying to be responsible and not being selfish and not taking that, well, it's my last chance, for Christmas or Thanksgiving, so I'm going to do it. And then, making that reality by the fact that, he gets sick and dies. And that's what we all need to do. It's a terrible choice. It stinks. I know it does. But just be responsible. Think of the future. How bad would you feel if you got someone in your family sick and they ended up in the hospital? And again, even if they survive it, now they've got thousands and tens of thousands of dollars worth of medical bills that they have to pay.
Well, and lasting damage. Studies are coming out saying that there's lasting brain damage coming from this. For those who are having to go to the ICU for a long period of time, are coming out with cognitive defects.
Yeah, that is not worth it.
There are real consequences to this type of stuff. And when you're talking about overwhelming the hospitals, it's already happening. We have reports coming from North Dakota saying that there are workers or medical staff that are being told to come back even though they test positive for COVID. So you have COVID-positive people who are working with vulnerable populations of people with or without COVID because they don't have enough people. They are so short-staffed, they don't have a choice. So in places like North Dakota, and actually it's happening here too in Wisconsin, multiple hospitals are telling nurses and doctors to say, even if you aren't symptomatic, you still have to come in. As long as you're not symptomatic, you have to come in even if you're positive. It doesn't matter. You still have to come in no matter what. There is no extended leave for COVID. There is no quarantining for COVID pause anymore. You have to be symptomatic in these hospitals, both in North Dakota and in Wisconsin. I'm sure in many other states too, it's getting just as worse. So when you have our medical staff and medical professionals who are the most essential workers we have right now are risking their health and the health of every single person they're coming in contact with, what are we doing? Why are we not taking this seriously when we are on the brink of absolute destruction and chaos of our medical industry here?
We need to be personally responsible. Isn't that what the conservatives are always preaching? Personal responsibility?
But they won't do it. I don't want to hear a single person tell me about the value of the free market again, because people aren't doing it. They're not doing the correct things when they're given the freedom to.
We do need leadership, and that's what we're sorely lacking currently.
And even when people do try to be good leaders, they get hounded by other people who are just insane and spreading misinformation.
Plotting to kidnap them. Well, let's talk about poor leadership.
Let's talk about one of these guys.
Scott Atlas
was in the news.
He is basically the one medical professional that the president is deferring to. He is not an immunologist. He is a neuroradiologist. So someone who looks at scans of brains
But a doctor's a doctor, right?
Sure. That's why, when you have problems with your feet, you go to a rhinoplasty surgeon. Because they're all the same. Let's not forget that Ben Carson was a neurosurgeon, but yet thought the pyramids were used to store grain.
So Scott Alice is a member of the White House Coronavirus Task Force. He's a senior fellow at the Hoover Institute, which is a conservative think tank at Stanford University. He previously argued that science of wearing masks is uncertain. Again, even as a radiologist, freaking stupid. Also argued that children cannot pass coronavirus, also stupid. Pushed for people who've been exposed to COVID-19 but asymptomatic to not be tested. And from a New York Times article about Dr. Alice, and I'm quoting from the article here, but it is Dr. Alice's embrace of herd immunity, see there's that phrase again, that has alienated his colleagues the most. When you isolate everyone, including all the healthy people, you're prolonging the problem because you're preventing population immunity, Dr. Alice said in a Fox News radio interview in July. Keeping with the quote, low-risk groups getting the infection is not a problem. In fact, it's a positive.
Which is something an insane person would say.
Yep, and that's on the White House Coronavirus Task Force, who's making decisions to lead our country.
He literally is the chickenpox party parent. I never got chickenpox. Did you ever get it?
Yeah, I did.
Never did. That's what having no friends as a kid will do for you. Have fun with shingles, bitch.
Damn, I'm going to get you chickenpox.
So, Atlas has recently come under fire for a tweet referencing Michigan's new coronavirus restrictions, where he said, the only way this stops... Well, actually, let me do a voice. I don't know what he sounds like, but I'll just assume.
Hey, he sounds like a douchebag.
The only way this stops is if people rise up. You get what you accept. He also added the hashtags Freedom Matters and Step Up.
I don't know why, but you sound like a whiter Ben Carson.
I was not sleepy enough to be Ben Carson. Ben Carson does not get that excited about anything.
And after everyone freaked out, respectfully so, he later tweeted, never, all caps, would I endorse or incite violence. Never. The fact that your White House Coronavirus Task Force member has to say whether or not or clarify they were inciting violence, while...
What does he think rising up as a people means?
Against the governor who was literally plotted to get kidnapped.
Well, we've already established he's kind of an idiot, so...
And again, I want to make this very clear. This guy is making decisions for our country. He's in the White House. And it was so bad that Stanford University actually had to make a statement, quote, the university has been asked to comment on recent statements made by Dr. Scott Atlas, a senior fellow at the Hoover Institution who is on leave of absence from the position. Stanford's position on managing the pandemic in our community is clear. We support using masks, social distancing, and conducting surveillance and diagnostic testing. We also believe in the importance of strictly following the guidance of local and state health authorities. Dr. Alice has expressed views that are inconsistent with the university's approach in response to the pandemic. Dr. Alice's statements reflect his personal views, not those of the Hoover Institution or the university.
Basically, he dumb.
And good for them for doing so. And then to make it even better, even Dr. Fauci had to speak out against it, saying, quote, I don't want to say anything against Dr. Alice as a person, but I totally disagree with the stand he takes. I just do, period.
Dr. Fauci, by the way, is an immunologist who is someone who studies the spread of disease, which is exactly the type of person you should listen to when we're talking about a disease that's being spread. Makes sense? Doesn't to some people, apparently.
Well, and that's a real problem we have in this country. Well, and maybe not even just in our country, probably worldwide too, where people literally do see the words doctor or the title doctor in front of someone's name, and they just assume you know what you're talking about, regardless of what kind of medical field it is. Because we had that several times where we had people who, I remember those 2 doctors in California who were spreading misinformation about COVID early on. We had Dr. whoever her name was, who was the main person in Plandemic, and people listened to her because she's a doctor.
The demon sperm doctor?
Well, there was that one too.
Yeah.
So we have to be very careful with our sources here, even though we have people who are doctors who should know but much, much better than what they do, which, again, is super concerning.
Any single person's opinion can be wrong. You gotta look for scientific consensus.
We'll actually follow evidence-based medicine.
Yeah, it's not hard. I mean, it's science, right? That's what it is. You have your hypothesis, you test it out, see if you can falsify it, make sure it can be replicated, then that's the best explanation we have. It doesn't mean it's 100% accurate, but it's the best we have with the information we have available. It can change. That doesn't mean it was ever wrong. We can update our knowledge.
But I do think a real problem we have, though, is that Americans, at least from what I can tell, I'm sure there are other people with issues across the world, but at least in the United States, people don't have these skills. They don't know how to conduct themselves in the scientific method. They don't know how to hypothesize. They don't know how to test hypotheses. They don't know how to experiment. They don't know how to look up research. They don't know how to analyze research when it's in front of them. That's why we have science communicators, right? But even then, people aren't even listening to the science communicators anymore.
They just look for whatever
Facts they want.
Right.
That's it.
You just go on Facebook and find a group full of people that are all telling you what you want to hear, and that's what you believe, regardless of if it makes any sense, if they have any sort of experience with the topic, if anything they're saying is reasonable. As long as they're saying what you want to hear, then they're correct. And I don't know how we really combat that. That is the problem with our information society, is you can find whatever information you want, good or bad.
Well, let's talk about things that are actually being done in the United States. First and foremost, mask mandates. The vast majority of states in the U.S. do have some kind of mask mandate. A bunch of others do have some time required mask mandates, and a couple of really stupid ones have no restrictions at all.
Including Florida.
Ding, ding, ding. I mean, when you have states like Florida, Georgia, Tennessee, Oklahoma, and Missouri.
Arizona, for some reason.
I'm very upset with you, Arizona.
It's funny because a lot of the states that have no restrictions are the ones that we just talked about as having increases in cases and deaths.
Yep.
Like the upper Midwest.
And actually, a lot of these new mask mandates are new in the upper Midwest. For example, Iowa's governor, who was not going to have a mask mandate due to such an increase in Iowa's numbers, kind of where we talked about with Iowa's rankings in the United States for COVID increases, reversed her decision and now has a statewide mask mandate in place. I think they were the newest one to have a mask mandate. Now in Wisconsin, like we talked about before, our mask mandate is actually being challenged by Republicans up to our Wisconsin State Supreme Court.
Conservative majority Wisconsin Supreme Court.
Did you watch any of this, Jason? Their opening arguments?
No.
My God. If there's ever a reason for people to want to vote in Supreme Court elections in Wisconsin, it's just to watch that briefing. Because when you watch the liberal justices just hammer the Republican guy, it was beautiful. And then watching the conservative justices just stammer through the most ridiculous nonsense I've ever seen. It just makes your head want to spin. But this is what our state Supreme Court is doing right now. This is what's happening in Wisconsin while we are literally at the worst peak of the COVID pandemic. And then aside from mask mandates, some states are doing some stay-at-home orders and advisories as of right now.
Well, one state is.
Right. So New Mexico is currently the only state with an active stay-at-home order. In New Mexico, all non-essential retail and indoor entertainment is closed, and citizens are urged to shelter in place for 2 weeks. And then several other states, including California, Wisconsin, us, Kentucky, and Massachusetts, are under stay-at-home advisories where their governors are saying, pretty please stop being stupid.
I think the entire world should be under a stay-at-home advisory at this point.
Which kind of defeats the entire purpose of having a stay-at-home advisory. Either have the stay-at-home order or don't.
So when are we getting those stimulus checks?
We'll have to see. We actually did see that Schumer and Pelosi have finally started talking with Mitch McConnell again for the first time about a new stimulus bill since November 3rd. McConnell is spreading his usual BS where he's trying to blame Democrats for not agreeing to a deal to help send billions of dollars to schools and help people with businesses and whatnot. What he refrains from saying is that the Dems have been pushing for a $2.2 trillion plan. And remember, this is coming from a $3 trillion plan that they initially proposed and approved to the Republicans' $500 billion plan.
That's the problem with Republicans, or one of the problems with Republicans. When it comes to bailing out businesses and spending money on bombs,
they'll do it gleefully.
They'll find the money. Trillions of dollars. Don't care. They'll figure it out. When it comes to programs for people and small businesses, Well, we got to be responsible in our spending. We can't increase the deficit.
Well, in this case, literally not bankrupting and killing a large chunk of our country.
What does that have to do with my lobbyists and my stock prices?
But this is also another Republican tactic as well, where you see Republicans intentionally lowballing all the time on this type of stuff. And when Democrats finally have the power to say, screw off, we have the votes, we're going to stick to our plan, the minute they deadlock, the Republicans are going to point to the Democrats saying that, and they'll just say, oh, look at how the Democrats are stopping the negotiations and how they're playing politics with people's lives, where we actually are the ones who want to spend all these hundreds of billions of dollars to help these poor families out. Screw off.
We've said it before. There's 2 bills that have passed the House that won't even be taken up in the Senate.
Nope.
Because they know it'll look bad when they vote against it. So they won't even vote. Mitch McConnell is one of the worst politicians that we've ever had.
Oh, by far.
And he just got rewarded with another term. So really, can we blame Republicans? We see it here. We talked about it. The Wisconsin State Assembly, they do nothing. They've done nothing. Least active assembly in the country. The Republicans won all their races in this election. Mitch McConnell won his reelection. Lindsey Graham won his reelection. The Republicans
by large amounts.
The Republicans picked up seats in the House. How are we going to say that they're not doing right by the American people when the American people continue to reward them for doing it?
Yep.
I don't even know what to say to that because it's accurate. Robin Vos continues to win re-election even though he's one of the biggest reasons why our coronavirus numbers are spiking as high as they are, and he's not even good for businesses here. We talked about the whole Foxconn thing. He's terrible. He's terrible in every possible way.
Well, and he went through the biggest publicity or negative publicity ever where he had all that PPE on him when he was pushing for the April primary election.
It's totally safe to come out and vote while he looks like an extra from the movie Outbreak.
And people don't care. They do not care. Kentuckians do not care. People in South Carolina do not care. And I legitimately do not know what to do with that large populace.
Yeah, I don't know. No answer from me, unfortunately. Listen to our podcast.
And then just to make some good news about what's happening, the FDA just authorized the first at-home COVID test, which I think will help a lot. But that means we have to rely on people to make sure they do what they're supposed to do. And I don't trust the American people at all at this point.
More testing is useful if you're going to be responsible with the results of that test. If you know you're positive, isolate. If you're not positive, that's great. It doesn't mean time to go out to the bars. So it all boils down to what people do, what actions they take.
Well, like you said, personal responsibility, right?
That's what I keep hearing.
Yeah. So take personal responsibility, be careful, be safe, actually care about others, quit whining about it. We'll get through this then. But until that day comes, you're going to continue to have your crazy Uncle Franks and Aunt Kathys who are going to spread misinformation and fear-mongering because they don't know what actual reality is.
And don't go over to their house for Thanksgiving. And don't invite them over to your house for Thanksgiving. You can go 1 year
without them
in isolation. It's not ideal, but it's better than everybody getting sick.
And actually, I did want to end on this, Jason. I don't know if you saw this, but the Georgia Institute of Technology, Stanford University, and a couple of other labs actually came up with a COVID risk tracker for those who are planning on traveling at all, where it shows how many people you would plan on having in your group and where you would have, and it shows the percentage risk of how, or what likely percentage of risk you'll have for contracting COVID in that area. It's actually pretty darn cool and pretty useful too.
We'll leave a link to that in the show notes. I would just advise you to not do it.
Right,
regardless.
exactly. This is for if you really have to or feel pressured to, or if you want to give hard data to your crazy Aunt Kathy who probably won't listen to you anyway.
To end out the episode, I would say be optimistic about the vaccine news. That will likely help us dig out of this eventually. But in the meantime, use common sense. Wear a mask when you're outside. That is the number one thing. And you know what? Put it over your nose, people. I cannot tell you how many times I've seen people walking around, going into restaurants, just walking in public with a mask underneath their nose. That's not going to help. That's not how it works.
I've seen too many chin straps too.
It's so frustrating. Wear the mask. Learn how to wear it. I don't care that it's uncomfortable. I really don't. I'm done with like the people, oh, it's hard to breathe.
I literally run with my mask on. You can spend 15 minutes with it on while you're going to the store.
It's really not that, especially now. It's cold outside. I like the mask.
Keeps your nose warm.
It does.
And you get to wear fun little masks too. Like there's fun little designer masks, and you could have like fun little cartoon masks or like little pun-based masks.
Somebody at my work had a Spaceballs the mask. I'm so jealous about that. That's the best one I've seen so far.
I've seen ads for a bird beak mask that is basically just a cloth mask with a gigantic bird beak at the end of it. And it actually opens and closes if you talk.
That sounds a little weird.
Well, screw you. I thought it was fun.
But yeah, just be safe. Limit your exposure. Don't spend the day going out shopping. All right? There's no reason to do it.
Black Friday sales are already happening online.
Yeah, online. Do your shopping online. Try to stay in your house. We're at Think Progressively Podcast are issuing a stay-at-home advisory. If you can hear me, stay at home. Thank you.
Other than that, have a happy Thanksgiving from our family to yours. Thank you for listening. We hope to see you in the next episode. You can find us on Facebook and Twitter at ThinkProPod. You can email us at thinkpropod@gmail.com. And remember, when in doubt, think progressively. Did you ever go to loser.com?
No.
Go to loser.com.
Nice. Yeah, I just realized in a couple months we're going to have to replace all the bumpers.
Do we, though?
I mean, I don't want to hear Trump's voice anymore after January 20th.
Efficacy in adults over 75 years of age was over 94%, which is good because that's our most vulnerable population.
So I have a question. When you read that and it said 65 years of age, why did you say 75 years?
Did I?
Yeah.
He recently named Jen O'Malley Dillon as deputy chief. I'm going to kill someone.
You're killing the English language right now.
Oh, my God. Maybe if I rhymed more, maybe I could say it then. Said this week that he and Warren have proposed to, oh, my God. I can't.
Joe can't read.
I can't read. I can't talk. Senity.
Senity.
Can I just talk like a normal person?